Thank you for joining us today. We're excited to have two great organizations with us. Again, if you guys don't know us, my name is Cecilia, and this is my wife Isabel with Gabriella Smile Foundation. And so with us, we have Keith and Steve. So without further ado, let me go ahead and introduce yourselves. If you mind introducing yourselves and who you're with and what you guys do.
Okay, you want to go ahead, Steve?
Sure, I'll jump in. My name is Steve Healy, and I am the co-president of the Brooke Healy Foundation. Foundation in honor of my daughter that is geared toward fighting pediatric cancer, specific DIPG. I'm also the membership and research ambassador to the DIPG collaborative.
Awesome. Well, thank you for being with us today, Steve.
Absolutely.
I'm Keith Deserick. I'm also a father, also an advocate. I am the co-founder and chairman of the Cure Starts Now Foundation. I also we were the folks that also administer and were the founders of the DIPG collaborative. Also created DIPG.org, and I'm also the president of the Pediatric Brain Tumor Consortium. So, but a parent just like you guys, and frankly, just want to get out there and try to do something about it and make a difference.
Awesome. Well, my wife and I were co-founders of Gabriella Smile Foundation. Our daughter, Gabriella, lost her battle with DIPG, and so now we want to do what we can. We want to join the fight to be able to not only spread awareness, but to bring in funds for research and help families across the country that are dealing with this deadly disease. So I commend both of you for what you guys are doing, and we're just happy to join the fight. So. So a couple of questions that we kind of wanted to ask you guys, and we'll start with you, Keith. What is the Cure Starts Now? Can you let our audience know what you guys do and what the organization is all about?
The Cure Starts Now is about 12 years old, which is frankly about as long as really a lot of the DIPG funding and a lot of the research trials are. We were started mainly because there was nothing out there at the time. There was barely even a recognition of what DIPG was. And we started out not specifically just as DIPG, but we focused on the idea that there were this huge wave of researchers out there that believed that if we could find a cure for tumors and cancers like DIPG, that'll provide vital clues for a cure for all cancers. And you can only hear that so many times before you start going, somebody needs to do something about it. And so that's what Cure Starts Now is about. We're the home run cancer research charity, and we're out there really advocating for really nothing but research. There's a lot of great organizations that do a lot of really great things. What we try to do is we try to focus on that home run strategy and eliminating cancer for good, because unfortunately we tend to treat cancers rather than to actually cure cancers. And so we kind of really wanted to focus on that. And today, the great news is that it's a team event. This isn't just Cure Starts Now. It's just not just my wife and I, thank goodness. It is, we have chapters all around the world. And then we also have wonderful partners in foundations that are maybe achieving their own goals as well, and they join us in the DIPG collaborative. And so all said, there's about 80 different families out there that are rallying for really the same thing.
Good.
Awesome.
Well, that's amazing, Keith, and your efforts and how your organization has grown. And Isabel and I heard about your foundation very early on when Gabriella was diagnosed, and so we commend you for your work. And it's certainly a testament. I mean, we heard about you guys while we were in treatment, and so it's certainly a good thing to have. And certainly we want to find a cure. We don't just want to treat it. Treating is easy. Curing is a little harder. And so we definitely need to find a cure. Okay, and with that,
we hope you don't have to hear about us. We hope that you never have to meet us. We hope that you're just cured. That's the ultimate objective, so we want to try to build upon that. And that's a cool part about what's happening now. There are lots of good things that are actually happening.
And that's good. I mean, parents, when they're told their child has cancer, the first thing you think of is how do we fix this?
Yeah.
Where do we go to fix this? Who can fix it? And I think what you guys are doing are leading the efforts towards that. So thank you. And now, Steve, would you let us know about your foundation and what you guys are doing?
And talk about a little bit more about the
Yeah.
DIPG collaborative as well.
If you could.
Sure. Yeah. So our foundation our mission is three-tiered, basically. We give back to the community because the community rallied behind us so much when my daughter Brooke was sick, that we give some scholarships to civically involved high school students in the area. We also help families with financial concerns as they're going through the fight for DIPG and other concerns. And then the third part, which is our biggest part, where we're going to focus most of our funds, is the research end of it. And early on, I said to myself, you know, I've kind of got a nice grab on the local market I'm in, and we're making an impact in that local market, but we need to do this nationwide and globally. And I had this idea that I was going to band all these foundations together, and like a day or two later, my wife said, wait a minute, I found this organization, the DIPG Collaborative, and they're doing just that already. So we immediately jumped on board with them, and I've gotten myself more and more involved as we go along. So, you know, what on the necessary research, and more importantly is the research that we fund is directed by the Medical Advisory Council that we have, the MAC. And us as parents, we're not doctors, we're not researchers, so we rely on their expertise, and we have a really, really great panel in the Medical Advisory Council that looks over the research. They look for what's innovative, they look for what's not being duplicated. They're state of the art with what's going on, and they give us recommendations of where we should put our funding dollars to, and that's how we do that. And also with the development of DIPG registry, that's allowing to develop gathering from that.
Exactly.
Well, you know, I remember early on when we were going through, you know, DIPG with Gabriella, I remember having a conversation with Dr. Orrin Becker. At the time, he was at Duke University. I think now he's at Northwestern. And I remember asking him, you know, about DIPG, and he says, listen, if we can unlock and find a cure to DIPG, then we'll unlock the cure to pretty much cancer. I mean, this is a nut that's been very difficult to crack. And, you know, and we're working feverishly to try to get a cure. And so he was very optimistic in trying to get a cure for DIPG and thinking that this would unlock the key to find a cure for cancer.
Yeah, well, that kind of brings me back to the next question. What is a home run cure?
Well, and that's, you know, touching on that point, you know, I think to a large degree it was a hunch of the researchers in the very early stages of this, but it's not a hunch anymore. The more and more we get into this, we're actually finding things that are changing the way we're looking at all cancers. You know, the development and the knowledge of looking at how histones affect cancer development, and some of these mutations that we've noticed. What's interesting about it is the things that we've noticed from those specific trials have actually translated into strategies for other forms of cancers as well. So we're already seeing this come to fruition. Granted, we're still early in the process. You know, if you look at it, DIPG research really kind of started about 7-8 years ago because we didn't know what we were doing. And so, but as we're seeing it today, it's really starting to become that. In discussion of what is the home run strategy and what we're looking for, we look for kind of three things in this, and this is what really started this entire emphasis on the home run strategy. We look for those types of cancers that affect children, because effectively these are the cancers that are typically some of the most pure cancers. They are the cancers that you can't really prevent your way out of, and they're the type of cancers that are sometimes our biggest bullies. We're also looking for cancers that even beyond that in kids, because with children, they typically can handle more of the different types of treatments. Their bodies are still developing and they're still growing and everything. And so people tend to think of kids as maybe weaker than adults in some way. But when it comes to cancer research, it's the exact opposite. It actually, most of the historical research and advances that we make in cancer actually come from pediatric cancers, and nobody really understands that. And unfortunately, we as a society look at them as lesser when actually they're the ones that are the heroes for all of us. The third thing that we look for in these home run strategies are effectively those cancers that you can't either use surgery or chemotherapy or radiation on. I think we as a society, since about 30s and 40s, we got a little complacent in how we focus on cancer research. And what we did is we looked at it and said, well, which ones can we cut out, we can burn, and we can poison? And while we got better at each of those three, in the end, we never really invented anything else. And it takes some of these cancers that are just so difficult and cancers that are immune to these other treatments to actually make you get out of your comfort zone and actually try something new. And so really in the darkest of kind of days and the darkest tunnels, I think is where we're going to find these cures. And we're not alone in this. I mean, if you look out there and you look at researchers, the entire DIPG symposium that today has had, I think we had 5 or 6 meetings, and it is the biggest collection of this home run talent, if you will. And I think we have about 160 some odd researchers that are coming to it this year alone. It was actually created with the idea of, let's find out if people believe in the home run strategy. And the result of which was that we had 120 people in a room that could seat 70 who showed up because they were so enthusiastic about it and wanted to do something about it. So it's really gaining traction. And I think especially what's really, really neat is as we go through the next year, this is going to get even bigger. We already see a lot of developments that are coming down the pike. We already see a lot of institutions that are getting involved with this and focusing on the home run strategy. And it is the future of cancer research. This is where it's going to occur.
That's great. And one of the I think the misconceptions, and I think you touched on it, Keith. Cancer is such a deadly disease, but there's this misconception that your doctor can fix it with chemotherapy or with radiation, at least for DIPG. And when we're out advocating and really raising awareness, people are really surprised at the fact that there's no cure, there is no treatment specifically for this type of cancer, for DIPG. And the survival rate is virtually, at 0% at about 2 years. And so people are really shocked when they hear that. They think, well, this child died of cancer, maybe the treatment didn't work, or perhaps the child was too ill, they caught it too late. But when we bring the research to the forefront and say, no, the reason these children are dying is because there's no cure. There's nothing that we can give these children that give them a fighting chance to survive. And I think at that point, people are really stunned that there's no surgery, there's no treatment, there's no chemo, there's radiation, there's just absolutely nothing that's working out there. And I think that's where researchers or foundations that give to research like yourselves, looking for cutting edge technology or looking for the home run cure, to be able to really narrow it down and say, this is what we believe is going to help these children, and continuing to fund these researchers will help us get to that home run cure.
Well, and if you look at it, this also isn't new. I mean, this is the amazing part about it, is that people look at this and they say, well, home run research, when did this happen? No, this has been around. Okay, if you actually go back and you look at the 30s and the 40s, we were doing this. As a society, we were focusing on those cancers that affected children, those that were the biggest bullies, those that we couldn't treat at that point with radiation and surgery. And what happened is we invented chemotherapy. And unfortunately, if you look from there on out, we started focusing on cancer by the numbers. And you cannot fight cancer by the numbers. You have to fight cancer by science. And so at the end of the day, if the way we're going to view our fight against cancer is which cancer affects the most number of people, and so therefore we're going to put dollars towards it, but there isn't an impetus for them to try to take the next step and invent something new because they can maybe treat it with some of the conventional methods, we're never going to come up with that fourth trial. And so we've got to get back to how we are fighting cancer, because we made great success. If you look from the late 1800s until, say, about 1940s, we created 3 ways today that we fight cancer. But since then, we've invented precisely none. And so it's not a function that we can't cure cancer. It's absolutely ludicrous to think that we can't cure cancer. We can. The problem with it is in how we do it. We've got to have that strategy. And what you see between your organization, what you see between, you know, Steve's organization and our organization is this rebirth of science, this rebirth of strategy, and saying, you know what, it's not going to be enough for us just simply to throw money at cancer anymore. We've got to do it, and we got to do it precisely. And we as a society have to make a promise to actually try to innovate. You can't get away with easy methods anymore. And that's got to be the bedrock of what we do, because otherwise we're going to be sitting having the same conversation 80 years from now, talking about how we should have done it 80 years prior.
Right. So,
and if I can just jump right on Keith's back with that, you know, it's actually a grant we funded, which was the DIPG registry. So when we were at the symposium, we were talking to the doctors and researchers and saying, what is it that you need? And they said, we need a database so that we can correctly study all the different, you know, the makeup of the tumor itself and protein extractions and scans and everything. So, you know, basically we built that system, the DIPG registry, with a grant from the DIPG Collaborative and the Cure Starts Now. And that model right now is the innovative model that's out there. That is the model that other cancers are reaching out to us saying, how did you do this? Yeah, and that is like, so we're on the edge of really making this turn into something bigger where it's going to be a database for all diseases, not just all cancers. And, you know, Keith might want to expand on that a little bit, but like some of the things we're doing is impactful now, and it's majorly impactful.
Well, and you talk about the registry. I mean, here's the ridiculous part about it. When we got into this, we as parents looked at the researchers and said, okay, what are we going to do? How are we going to do this? And everybody said, well, there's this drug that's being used on lung cancer. There's this drug that's being used on breast cancer. We'll give it a try. And we looked at everybody in that room and we said, so you're just guessing? Okay, or you're just picking a drug up and saying, let's give it a try? Well, that's not strategy. And so what we came to them is we said, there's no way that we're going to be able to do that with by just simply having things that are non-strategy related. What we have to do is we have to focus on actually getting information about DIPG. And in order to get information about DIPG, we have to actually go out and collect it. And everybody looked at us and said, well, that's crazy. You're never going to be able to collect it. And if you're going to collect it, it's only going to be one data point. Well, as Steve pointed out, we have the first linked database on DIPG information out there. And frankly, it is being used. I mean, as we speak today, we're being contacted for all these other forms of cancers that say, wait a minute, we don't even have it for breast cancer. We don't have it for lung cancer. So does that mean that we've just been guessing on everything?
Maybe.
We got to do better, and we're already doing it.
Yeah.
Well, I know, you know, when we were diagnosed, our doctor was open to any of our suggestions for treating my daughter, and that was a little bizarre. And we love our doctor, but you know, that just kind of tells you where we're at with this particular diagnosis and tumor. And so I think you're right, being more strategy driven versus just kind of giving the kids what we think may work on a tumor that wasn't, you know, on a medicine that was designed for a tumor that's not DIPG. I mean, that does sound, you know, when you think in retrospect about all that, it does sound a little silly. And our kids don't deserve silly. They deserve the best. They deserve something that will help them to live.
Well, and Steve, I don't know if you want to talk a little bit about Connect too and kind of that next step. I don't know if it makes sense to get into that.
Yeah, I was, and just to go off what he was just saying first is, you know, we've never been out of a phase 1 trial with DIPG because it's been that guessing game. You know, you're guessing, like Keith said, the drug that worked for breast cancer, the drug that worked for, lung cancer, something like that, and then it's a phase 1 trial. It never gets out of phase 1. So obviously this next step with the registry is going to be to develop those trials. And Keith alluded to Connect. The Connect Consortium is the next step of how we're going to be treating cancers and how we can take the research and the models and speed up the process. Not only speed up the process, but as you know, if you're looking for a trial, you know, you might be packing up the family and moving across country to go to the hospital. You know, families are going to break up. Someone has to stay home and work, possibly with another sibling. You know, another parent's cross country trying to, save your dying child, basically. So part of what the Connect is going to do also is allow that satellite hospitals can run that trial under the supervision of the initial hospital, and you can stay in the comforts of your own area, possibly even your own home, to get the treatment that you think is the best treatment out there. And that's one part of Connect. And then Keith, I'll let you do the medical connection to how we can speed it up and the research is impacted at a faster rate.
Well, effectively, the short message of it is that Connect is designed to do trials 3 times faster than what we're currently doing. When you do a trial, and I'll spare you the flow chart because my goodness, now I'll get into this whole entire discussion, and I get excited about that. But effectively, what happens is you get a concept, you find out whether it works, then you publish, and you hope somebody else picks up the baton to take it to the next step to create a clinical trial. What we looked at is we said, well, that's great, but why aren't we doing this all at the same time? Because I don't like it where you're passing the baton. When you pass the baton, then something gets dropped. So what we want to do is we want to have it so that it goes immediately from that and goes directly into that clinical trial. So as soon as you pick up a spark of something working, then let's get moving with it. And we, by virtue of the DIPG collaborative, by virtue of foundations like our foundations here, we have effectively built a model that moves that along and doesn't lose anything in the middle of it, and also make sure that publishing doesn't create an obstacle, but it also moves it along at 3 times the speed. And that's what we want. We don't want to be having to ever tell a child, we don't have something for you. We want to have it ready to go.
Wow. Well, that's impressive. I was going through the Pure Starts Now website, just getting more information about it, because I feel like it's important for, we have a 5K coming up, and we're really excited because we have already over 340 participants registered, so which is awesome.
Yeah.
And thanks. And and our run is, the purpose of the run is to raise money for research, and it's in May during pediatric brain cancer awareness month. So we thought it was perfect. May, gray, let's go gray, let's do the cupcake run. And we're doing the theme cupcakes just, because Gabriella loved cupcakes. And so we thought it was something fun. And so we had a great cupcake run last year. We raised about $5,000. This year, our goal is to raise more than that, twice, hopefully, and maybe 3 times as much. But, we've been sharing with our participants that we are doing this for, to raise money for pediatric brain cancer research. Right. So we felt it was important to bring you guys on and just talk to you all and to share with them, where their money's going, what it's doing, the impact it's going to have. And so I was really, really impressed with on the website, you have all these stats, over 40 chapters on 3 continents. Amazing. You're operating with less than 3% overhead. I mean, that is huge. I can't even tell you how many times I see friends, raising money for a great cause, but it's an organization that is not operating with less than 3% overhead, and it's not an organization that's giving more than 1% to pediatric cancer research. So, this is big. Your donations, our cupcake run participants, everything they're raising, everything they're giving towards this, it's going towards research, and it's going to the Cure Starts Now, who operates with less than 3% overhead. That is huge, and congratulations on that. That's amazing.
Well, thank you. But it's a parent-led organization, both Cure Starts Now and DIPG Collaborative. So when parents are doing this, we're all about efficiency. We're all about getting some results to it. I mean, right. let's be honest. None of us want to be doing this. Okay. Right. At the end of the day, the biggest celebration we're ever going to have is when we make all of us, close down all of our organizations. That would be wonderful.
That's true.
So it's got to be efficient because that's how it works. But it's also a testament to our DIPG collaboratives, a testament to other foundations that it can take that leap of faith and saying, it's greater than just us, and it's about the whole, and it's about our kids, and really put the importance on it. So while I appreciate the the focus on it. I think it's very much a focus and frankly a testament to your guys' involvement in it and getting the word out. I mean, you know, a lot of people also talk about awareness, and they talk about getting the word out and trying to get folks to get on board. At the end of the day, I mean, it's helpful, but it's not going to cure cancer.
Right.
And so it takes folks coming out, not only supporting, but also fundraising for this. I would love to be able to do this without having to raise a nickel. But in reality with it, there's nobody else doing anything.
Right.
And so if this is going to happen, and if this is going to gain that momentum, we require we require your supporters, we require people who aren't facing DIPG to get involved and realize this is a home run cancer, and this is not only going to affect somebody else, this is going to affect me sometimes in my life. I mean, what's the stat? I think 1 out of 4, 1 out of 5 people are going to be affected by cancer. Well, this is your battle, okay? This is the difference between you having odds or having a cure. And folks have got to understand that, because that's what makes them put the running shoes on. That's what makes them get up at 6 a.m. And it's what makes them come out. And I would highly encourage them to be part of it, because by doing so, this is a revolution. You're participating in a change of how we focus on cancer research.
So true. Steve?
Yeah, and also I just like to say the immediacy of it. I mean, the funds that you raise at your run are gonna, you know, go to the DIPG Collaborative, go to the Cure Starts Now, and we're gonna put those funds to use immediately. And you know, we're trying to expand our registry as we speak, like we said, beyond DIPG to other pediatric cancers, home run type cancers, and you know, there's interest in other parties saying we want to expand this to all any type of disease, not just cancer. So those things are happening now, and they're happening in the immediate future, so that those funds get put to use immediately and to good cause, and like you said, with very little overhead, if any at all, to focus on what we focus on.
Yep.
That's amazing. Well, I know that we all, you know, all the work we do, most of us, we do it for free, but we do it with a purpose, and we do it with a passion and a desire to find a cure for this awful, you know, I can't say enough bad things about this disease, but yeah, you know, to help families tomorrow, and you know, next month, next year. So and then I see funding, you 80+ grants in 11 countries. So you all do, you know, you're aware of what's going on around the world, the research that's going on, and again, if it's promising, if it's going to help us find a cure for this, you all offer grants for that. So that's awesome. Over $12 million since 2007. That is amazing.
Well, and I'm hearing the statistics, and that's the reason I'm kind of looking around as I'm going, I thought we did more. So it makes me think that we need to update the statistics. But that's I guess that's a good thing. If our statistics can't keep up with the trend of funding in cancer research, that's okay. I guess that's not a bad thing. We just got to go update a website too.
Yeah.
And it truly is.
It's still impressive for me. I mean, it's incredible.
Yeah. Thank you.
Well, we're really excited to share, with our audience and in our neck of the woods over here in Texas about all the great things you guys are doing, and we hope that it makes an impact, especially when as for us, we're getting closer to our event, and specifically because we're trying to raise funds for research, and so we help families like you guys do, Steve, but we don't want to forget the aspect of research. Research is really important. It's really key, and it's through that research that we're going to help find a cure, hopefully within our lifetime, to DIPG and cancer. And so we're excited to participate and be a part of this, of raising funds for research, and being able to support you guys in your efforts to help find a cure.
Well, we welcome you aboard. We wish you the most success that you could possibly have. And like I said, we're going to make a difference, and we're all going to do it together, and that's what it's going to take. That's
right. And what we'll do, we're going to go ahead and put links to your websites on this video when when we post it. And so we're excited. We hope people that are watching can connect with you guys and look and see what you guys are doing, or even if they connect through us, just to see what you guys are doing. So we really appreciate it. And thank you so very much for taking time today to speak with us.
Well, thank you.
Absolutely.
Was there anything else you wanted to add or say?
I think we hit on most of it. Like the one thing I was thinking of when Keith, you were talking about some of the statistics with the Cure Starts Now and the collaborative, it truly is a global impact, and we can't be naive to think that this only happens in the United States. So when we do fund grants, we fund them internationally for that reason. Whoever or wherever the cure comes, we're going to welcome it with open arms. And so we're trying to reach out globally by having our next symposium in Sydney, Australia, and connect the world. And that's what we're doing, because if everybody's working together, it's going to happen faster than if we just concentrate on one lab in one city in one state that,
Right.
you're spinning your wheels a little bit and you're restricted to what they can do. So the global impact of what we do is important.
Yep, exactly.
I love that that perspective. It's not just DIPG just doesn't happen here. Cancer just doesn't strike here. I mean, it's a global epidemic, I should say. I mean, one child is one child too many, to have cancer. And so if there's a way for our concerted efforts, here in the country or across the world, to really come together and really collaborate and help find a cure, I think that's the best route to go.
Yeah.
So
Definitely.
So we thank you guys. Thank you so much, Keith, for coming on. Thank you so much, Steve, for coming on. We really appreciate you guys. Appreciate your efforts. Appreciate everything you guys are doing with your foundations and with your work in your particular area. So thank you so very much.
Awesome. Thank you. Thank you so much for joining us today and sharing more about the Cure Starts Now and the race to find a cure.
Well, it's about us all, and good luck. Do well.
Thank you.
Thank you.
Let's post.
Thank you. We will.
All right.